Bronchoscopy is a medical procedure that allows doctors to look inside your airways, specifically the tubes that carry air to your lungs. It's like a tiny camera on the end of a flexible tube, and it helps your doctor see if there are any issues with your respiratory system. Now imagine a small, thin tube about as thick as a pencil called a bronchoscope, with camera at its end. If your doctor recommends a bronchoscopy, they will discuss its reasons, what to expect, and any potential risks involved. Doctor may ask for blood tests including platelets counts and INR. Do ask questions if in doubt. You will not be allowed to eat for a few hours before the test. The hospital will tell you for how long you must stop eating. Usually it is for 6 hours. After this, you should only take water. Then, 2 hours before the test, you should stop drinking as well. You will have a sedative injection before the test to relax you. The area where the tube will go in is numbed with a throat spray, if the tube is going through your mouth, or a gel, if it's going into your nose. You may have a plastic device in your mouth to keep it open. You'll be asked to lie down, and a small tube will be placed in your nose or mouth and gently guided down into your airways. Staff will make sure that you are comfortable. The tube is passed through your nose or mouth and then down into your airways and lungs. This may make you cough. A camera at the end of the tube can take photos, and samples from the lung tissue, biopsies, can be taken. How long does it take? About 30 minutes to an hour. The bronchoscope then goes down the throat, past the vocal cords, and into the bronchi, the main passageways into your lungs. The bronchoscope's camera sends back real-time images, offering a clear view of the patient's airways and lungs. It's like Google Street View, but for your respiratory system. This allows the doctor to spot any irregularities or signs of disease that may be present. Sometimes the doctor may need to take a small sample of lung tissue or fluid, a process known as a biopsy. This can provide crucial information for diagnosing conditions like cancer, infections, or lung diseases. Once the doctor has gathered all the necessary information, the bronchoscope is gently removed. You can go home once the sedation wears off, about an hour. Make sure you arrange for someone to take you home, as you're not allowed to drive for 24 hours after a sedative. Are there side effects/risks? Your nose and throat may feel a bit sore for a day or so after the test, and you may have a hoarse voice for a few days. You may have a dry mouth for several hours after the procedure. You may also cough up some blood the next day if you had a biopsy during the test. A rare complication can occur, especially if you are having a biopsy. The complication involves the leakage of air, resulting in a collapsed lung, pneumothorax. Why is bronchoscopy important, you may ask? Well, it's a procedure that allows doctors to diagnose and treat a wide array of lung conditions, from infections and blockages to cancers. If you have any question, do ask your doctor. Before the procedure, make sure to inform your doctor if you are taking any blood-thinning medications. These medications can affect clotting, and your doctor may need to adjust your treatment plan to ensure safety during and after the bronchoscopy. In the grand scheme of things, bronchoscopy is an important test in the world of medical science, shedding light on the hidden depths of our lungs and paving the way towards better lung health. Thank you for listening. Subscribe to Decoding Respiratory Medicine.